What I'm going to share with you today is an innovation project that we undertook that sought to increase the number of patients we safely discharged from our A&E department, and if not the A&E department, then the next step on their journey, which would be our emergency admissions unit. Like all health organisations, whether commissioning or providing, there are competing priorities, and unfortunately at the end of our pilot project, when we were just getting a feel for what we might have to do to improve and what we were just starting to learn, it wasn't substantiated. So we thought, well, we'll have to look at our existing resources and see what we can do a little bit differently and reorganise ourselves, because we really felt that it was something worth doing. So the journey that I'm going to share with you is where we went in order to provide that substantive service from our existing resources. But keeping the patient in the centre, but knowing that we had to change our workforce around that, we undertook some process mapping for both of them actually. What happened to our patients if they didn't get out with us, seeking to understand that in terms of the clinical evidence. And because we're working with older people, there's some good social studies as well that tell us the impact on families. Like most acute trusts, we look at our readmission rates on a monthly basis, and none of the patients that we have discharged up until now have been readmitted either from A&E or from our emergency assessment unit. So I think there's something around this criteria that we've developed. It is safe and we are making safe decisions. In summary, I was privileged, I think, really. We work very closely with our patient and carer involvement team, and they have a very structured programme, and everybody gets their turn to have their patients' stories collected, and they've just started to collect ours in relation to this pilot now. And I think, I do think it was a privilege to hear what this daughter said about the care that her mother had received. So this is in quotation marks, with Dr. So-and-so saying to me, "Mary, we're looking after your mum together. And we're doing such a good job, you know, we're doing such a good job." Really, I have to say, it meant the world getting her out early, you know, when we did, from the accident department. And I think that sums up that our patients are having better experiences than what they had previously.